Hi, I'm Dr. Satish Kumar, and this is Kaizen Dental. Our aim here is to help dentists succeed. In today's Kaizen Dental Success Stories podcast, we have with us Dr. Sujit Pardeshi to talk about the importance of communication skills in a dental practice. Dr. Sujit Pardeshi is a best selling author and an international speaker. He has done his MBA in Human Resource Management after completing his BDS. He is awarded Certified National Trainer status by Junior Chambers International for soft skills and management skills. He has developed a special training for doctors and dentists. He has conducted hundreds of seminars and workshops nationally as well as internationally. He is the founder of Millionaire Dentist Hub and is on a mission to help 1 lakh dentists globally to build millionaire dental practices. He has authored the best selling book New Age Dentalpreneur, Develop a Competitive Edge and Build a Profitable Dental Practice, which is one of its kind books on soft skills and management skills for the dentist. Good morning, Dr. Sujit sir. You are a maestro when it comes to practice management. You're among the rare few who have told that do not only focus on clinical aspect, there is another whole ocean of skills you need to develop to be a successful dentist. So thank you for being among the first few to do that in India. So, sir, today's topic is going to be on a topic which I'm sure is close to your heart: communication skills, where our entire dental curriculum of 5 years focuses continuously towards improving your clinical skill with the concept that if your clinical skills are good, patients will automatically come. But you are among the few who started that communication skills is more important, if not equally, as compared to the clinical skills. So I want to know, sir, from you, the first question is, how do you think communication skills affect a dentist success overall?
Okay. So first of all, hi and hello everyone who is watching this video. And guys, this video can actually change your life because there's a lot which, as a practicing dentist, and if you want to, start your own practice, which you need to know apart from clinical skills. And with all honesty, it's not just about a practicing dentist. No matter in which field we are, uh, one of the most important assets which any human being can have is the effective communication, irrespective of whether you're going to start your practice after BDS, whether you're going to do your post graduation, thinking of going abroad or whatever. So thank you so much for having me here on your YouTube
Thank you,
channel.
sir, for
And
giving us time.
right in the beginning, I must compliment you for the wonderful job which you are doing for the young dentists.
Thank you, sir.
Because there are very few, as when you said that you are one of those rares, so I should give you the same pinch because you're also one of those rare people in dentistry who are doing something different, something better to overall uplift the direction, environment, the positivity, the mood, and most importantly, the results of the practicing dentists or the young dentists across the country. So wonderful, and thank you for this opportunity to share my views on this particular subject. Now, coming to the part when you said that how important is communication. So communication actually is the most important thing because no matter how good clinician you are, unless you communicate your treatment plan properly, unless you are able to convince the patient for whatever the dental problem the patient has and the treatment which is required, there is no scope that the patient is going to say yes to you automatically and get the treatment done. If your communication is not effective, the patient might sometimes say you yes, but the moment, because the patient is in the severe pain, but the moment the pain is gone, many times the patient do not turn up for the remaining treatment. And that's the reason, through your communication during your patient consultation, you need to ensure that patient completely understand what's the problem and what exactly the treatment required. How many appointments, how much of duration, the cost, how it's going to be done, if there are going to be any complications, the payment which patient has to pay, and all those things. and so that the patient can come back to the treatment on time as per your appointment schedule and complete the treatment. So no communication, the chances of patient not accepting the treatment, and even if the patient starts the treatment, not completing the treatment are very high.
So, sir, what is the most common mistake? You've trained so many people across India. The common mistake you see dentists doing when it comes to communication with patients.
See, frankly speaking, the commonest mistake is not just about communication. With all honesty, the commonest mistake is every dentist who is into the dentist college, whether doing a BDS or a post graduation, whether they are about to start practice or have started practicing, the commonest mistake is, and the biggest mistake it actually is, they focus only on clinical skills. They miserably fail to understand that you need a patient who accept your treatment in order to show how good clinician you are. And that's why I always say that dentistry is all about 3M. And the 3Ms of dentistry are marketing, management, and professional mastery. So professional mastery is your clinical skills. The role of marketing is to ensure that you have patients in your waiting room. Because unless people in your surrounding know that you exist, how will they come to you? The role of marketing is to ensure that you have those potential patients. The role of management, that is soft skills, and communication and presentation are the most important soft skills, is to ensure that those patients accept your treatment. And then the clinical skills ensure that whatever you project in marketing and promise during patient consultation, you deliver the same through your clinical skills. So the biggest mistake definitely is to focus only on clinical skills. I'm not saying clinical skills are not important, but honestly, none of these 3Ms are less or more important than each other. All of them are equally important because it takes every aspect of your practice to build a successful dental practice.
Understood, sir. So, what are your suggestions when it comes to the first consultation? How should they go about doing it? The major
See,
mistakes and how can they avoid in that?
yeah, as I said, the commonest mistake is just focusing on clinical skills. The most important thing, if you really want to conduct successful patient consultation, is you need to learn soft skills professionally. Unfortunately, in our country, the professionals are not taught soft skills in a professional way. And India is not just the only country. There are more than 100 countries in the world where the soft skills are not taught to the professionals in a professional way. And I always had this long-standing wish that the soft skill curriculum should become the part of mainstream curriculum. Because across the world, especially in the Western world, this has already happened and the benefits are already there. In fact, just a couple of weeks ago, I was reading news where the National Medical Council has, in principle, gave the nod that soft skills should become part of medical curriculum. And that is where everything is going to change in the future. Because there was a newspaper headline that does the good degrees in medical field make good doctors or something like that. And in fact, there was another very important survey that was done by IIM Kozhikode, and they found that the doctors are few of the worst communicators across the country. And and it's all because there are no soft skills, right? So because there are a lot of aspects. The point is, the biggest problem is whenever any patient walks in, if you don't greet them well, okay, you may not get a chance to treat them well. Okay, it's very simple. It sounds very simple, but I'll tell you what, you must greet everybody with a smile. And especially if you're a dentist, and if you don't have a smiling face, how will people believe you? Okay, so the commonest mistake is our entire focus is on the tooth. The moment patient says that there is a problem, the moment patients say that this tooth is paining, the biggest problem is people focus only on the tooth. And you know what starts in a dentist's mind while they are doing the consultation is, what's the problem? Do I need to take the X-ray? Probably this tooth will need a root canal. You completely forget that there is a live human being which is attached to that tooth. Okay. And the most important thing is, if you do not convince that human being, no matter how well you can treat the tooth, you may or may not get the chance. So focus on every aspect of communication and presenting the case properly to the patient. And where the attention, whereas normally the attention goes completely to the treatment part. And many times the dentists struggle either to get the patient or to convince them for the treatment.
So, sir, when we explain this entire treatment plan, one fear young dentists have is giving the exact price quote or explaining the charges to the patient. How can they overcome that particular fear?
Again, talking about price is always very difficult for us simply because we are not trained professionally to talk about money. Okay. The moment you start talking about money, there is a, subconsciously at the back of your mind, you get this feeling that, what the patient will say next. Will the patient say, oh, your charges are too high? Will the patient start bargaining? Will the patient go away, or run away or go to some other dentist and so on? And the moment these thoughts you have at the back of your mind, the problem is it gets reflected on your face. You need to understand that there are two aspects to a practice. One, doing the best of the treatment. And the second, managing your practice as a whole. So when you are doing that patient consultation, in the business terms, you're actually selling. You're selling the treatment. You're selling why this treatment is required for that particular patient. And when it comes to sales dynamics, talking about fair charges in a fair way is not at all guilty. Because ultimately, you're going to relieve the pain of that patient. Maybe you're going to improve the function of that particular tooth, or maybe the aesthetics for that particular patient. It's not just about treating teeth. You improve the function, you improve the form, you improve the aesthetics, you improve the personality. So there should be no guilt when you talk about money. See, if you need a patient, let me tell you, even patient need a good dentist. And the day you understand it, you will be confident enough to talk about money. There should be no guilt, because that is where everything starts going in the wrong direction.
So it's basically the guilt which is keeping us scared or fearful from telling the cost, which we need to overcome. That's the main criteria.
Not just the guilt, but the fear of losing patient. I always say this: the biggest fear in dentistry is not the anaphylaxis shock. The biggest fear in dentistry is always the fear of losing patient.
Yes,
and that
exactly.
Fear of losing patient brings that guilt on your face. The fear of losing patient makes you skeptical when it comes to talking about money. The fear of losing patient takes your confidence down, your voice down, and your face, what you can call it, like ocean. Expression. What will patient say next? And all these things actually are negative for yourself and your practice. So you need to work on this in a very systematic way.
So what you told was about not just the verbal, we need to even focus on our face. So what is the difference, and can we control both of them?
Wonderful. Yeah, very nice question. Because see, when it comes to effective communication, there are three elements to effective communication: the words you speak, your voice modulation, and the body language. So it's very necessary that you should speak or about that particular patient consultation, may it be any problem. You should be very clear, concise, and complete. Many people think that if they speak more, the person who is listening will understand it better. That's not correct. When it comes to effective communication, your words must be clear, complete, convincing, concise. Now, when it comes to voice modulation, it's not about the quality or the melody of your voice. It is about the pitch of your voice, the pauses you take when you talk, and the emphasis or the stress which you give on the words. Effective communication says that your words contributes to only 7% of effective communication.
Oh.
Your voice modulation contributes to 38% of effective communication. And your body language contributes to 55% of effective communication. When it comes to body language, that means it's pure non-verbal communication. And see, your body language contributes to 55%. What are the elements of body language which matters? It is the gestures, your hand movement and facial expression whenever you're speaking anything. And I want you to, like you're watching this video, I want you to observe what I do within next 1 minute. Okay. And you'll come to know about the importance of body language. Okay. The body language, the gesture, that means your hand movements and your facial expressions. They should be in sync with your words so that they become effective. Now here you saw the pitch, the pause, the emphasis, the gestures, right? Because when you say it has to be impactful, it has to be effective, you cannot say it should be effective. It should be effective. You can't say like that. You need to be effective when you say effective. So that's the gesture, the posture, how you stand and sit in front of the patient, the eye contact which you maintain. If I start talking to you like this, without establishing the eye contact, how does it look? And trust me, there are dentists who talk to patients like this. So it's not about what you say, it is about how you say and how well you say. I always say this, every single word, every single sentence and para can make or break your patient consultation. And patient consultation is the most important prerequisite to do that treatment and become a successful dentist. So focus on all these three elements and improve yourself with every passing day on this.
Understood, sir. So, sir, my next question is, there are certain dentists who say they are very comfortable, they're confident on your work, so they can explain patients very well. But they have a problem of how to communicate with assistants. There's this fear, if I'm rude with my assistants, they will leave because they are the most important person in the clinic. How do they communicate with staff per se?
Okay. The communication of staff, to it's a complete different subject altogether, but I'll give you a few things. Remember, right from the day when you hire your staff, there should be an absolute clarity of their job role. That means what all the things they will have to do once they are hired. What are their responsibilities? They should be made responsible and accountable for their own work. Now, when you do that, the best part is majority of the friction goes away. Remember, clarity brings conviction. Whenever there is a clarity, they right from day one, they know whether I can do it, whether I'm comfortable in my shoe in, while doing this work or not. Clarity creates the conviction. So you should be clear right from day one. And now when you are clear, the only job which you have is to take the follow-up, whether they are doing it right. And if they don't do it right, you can always say, this has been told to you right from day one. You don't have to shout at them. You don't have to get angry on them, because honestly, anger doesn't work in the long run. Okay. You get instant result if you get angry, but then the results are temporary. They will make the same mistake again after a few hours or a few days. It's the communication that's important. And that's where the communication with your staff also plays a role. So the role clarity is important, and then taking the right follow. Whenever they make a mistake, point out that mistake. Whenever they do something good, appreciate. One of the biggest problem with majority of people is they scold their staff. They point out their mistakes every single time they make the mistakes. But throughout the day, when they do all things in the right way, you never appreciate them. Start appreciating people. Start appreciating your staff when they do good. You just say, good, you did a good job. Or sometimes if they do something exceptional, I'm proud of you. This is what I had expected. Or if they don't do well, there's no need to shout. You can tell them, I have very high expectations from you. I didn't expect this from you, and so on. And that's it. And every human being understands the connect and the intent. Remember, your intents are more powerful than your content. Okay. So this is how you should do it.
Understood. So, sir, what would be your advice to a lot of young dentists who are either in BDS right now, just finished their internship, or starting out? How do they work on these skills, and how do they even just start about? What is your whole idea about it?
Right. So my frank advice is, even if you're suppose in your internship, just start learning these skills. Okay. And communication though is the most important skill. I'll give you one simple reason why. See, every medical field, okay, every medical field is a compulsive field. That means even if suppose you get typhoid or viral fever, you cannot postpone the treatment. Oh, I don't have time today. Okay, I have a family function. I have to go on vacation. You can't do that. You have to get the treatment done then and there at that moment itself. Even if it's a simple malaria, typhoid, or as big as angioplasty or heart attack, whatever. There is no option. But when it comes to dentistry, the moment the pain is gone, lots of options are there. The patient can always postpone the treatment by taking the tablets repeatedly, by just doing some temporary filling, by just avoiding it, by just cleaning the area, putting some glove or camphor or whatever into the tooth. Pain relief is the only compulsive thing in dentistry. Every medical fraternity is a compulsive science, whereas except pain relief, dentistry is completely elective science. Patient can always postpone the treatment or choose a better treatment. And the worst part is the biggest treatment or the most commonly chosen treatment which patient can is tooth extraction. Even if the patient needs a root canal, he can extract the tooth. Even if patient needs whatever, but extraction is the simplest option. Although it is not correct, and that only you and me knows. But for patient, who is going to do all this 5 appointments and so much of expenditure and the pain, just extract the tooth and the pain will be gone. The problem with dentistry is, except pain relief, everything is elective. Now, when it is elective, that means patient may or may not choose to do it, the dental treatment. So you need to be even more effective when it comes to patient consultation and your communication. Because if you fail there, your conversion ratio will be low. So communication skill is extremely important. If you are someone who has not yet started the practice, maybe you can literally delay your practice, starting your practice by a couple of months, but learn soft skills, communication skill, presentation skill, management skill, leadership and team building skill, and interpersonal and rapport building skills. This is what will take your practice to the next level, right from the beginning.
So, if there are a lot of young dentists who have heard you right now and know this is the next right step they need to take, how can they contact you? Because I know you take courses frequently and you're one among the best teachers to teach the skill sets. So, how can they contact you and how can they take this forward? Do you have any specific courses focused towards them?
Yeah. So, see, if you are a young dentist, the first good news which I can give you is on 15th of August, I have launched one course called Practice Startup Formula. It is for those who want to start their practice. And I have given this course absolutely free of cost to anybody and everybody who wants to jump in. Okay. So it takes a lot of efforts to create a course out of nothing. Okay. But then the point is, because I remember when I started dental practice around 22 years ago, we were absolute directionless. And I'm sure there are thousands and thousands of dentists like me who don't even know what all they need to do as a part of infrastructure. It can be as simple as that plumbing, electricity, POP, or the fire safety, the furniture, the modular furniture, what's the difference, how to select the dental chair, how much should be the area of your clinic, how to select the right location, how to select the name, tagline, what are the branding elements you need to focus right from day one, how to select the staff, how to define the role clarity, what is the basic record keeping which you should have, and so on. And what are the marketing elements you need to focus right from day one? What are the different marketing skills which you need to have even before starting your practice? What are the minimum dental equipment and instruments which you should have if you want to start your practice? I have covered all these things in this very, very powerful course called Practice Startup Formula. And even if you are someone who has already started practicing, trust me, these 10 videos will be very, very helpful, because I'm sure you have definitely missed at least few points from this 10 video. There is a lot which I have covered. It's like more than almost 3 hours of content in 10 different videos. I strongly want all of you, those who is, if you are listening to this, and make sure that you just jump in, because any which way it's a free course and it has been really designed very powerfully, created and shot very powerfully. The content, the context, the flow, You will really love it. So this is the first step to start the practice. And if you really want to build your successful practice, I am conducting actually courses since last 9 years. I have trained to more than 4,000 dentists and more than 1,200 other doctors, including the cardiologists, gynecologists, orthopedics, pediatricians, oncosurgeons, and whatnot. So fortunately for a lot of people, after the COVID, I shifted one of my courses to online course, and that has actually become a blessing in disguise for so many of the practicing dentists. And we have recently completed 1 year to this online community. And I'm so happy to share that in just 1 year, we have, as of today, 2,168 participants in this online community.
Good.
And you'll be surprised to find that people have grown their practices by 50% in 1 month, doubled their practices in 3 months, tripled their practices in less than a year. So if you want to jump into my course curriculum, my community, and I keep on conducting a lot of live sessions for my community, even after they enroll into the course curriculum. Because you need the right environment to grow. I always say this, your environment is always more powerful than your willpower. So put yourself in the right environment. If you think that you resonate with my way of teaching out of whatever you listened to last 20 minutes, so you can jump to my course curriculum. If you think you do not, you can learn this from anybody. But the point is, you must learn 3M properly. Otherwise, I'll tell you what, only with clinical skills, if people don't know that you exist and how good you are, how well your clinic is equipped with all the facilities and treatments which you do. If people in your, in your surrounding area, in your vicinity do not know about this, there's no point you can become a successful dentist, because it takes all these 3 aspects to become a successful dentist. And I conduct a free webinar every Thursday night to give the preview of my course. Of course, I add a lot of value for 90 minutes in the webinar, and just for 15 minutes, I talk about my course. If you want, you can just jump and enroll for that free webinar.
So please do share the links with me. We will put it in Instagram.
Yeah. Yes, I'll share the link for that practice starter formula also.
Yes.
And for that free webinar.
So guys, if you want to learn, do not forget to check our Instagram page about it.
Yes, sure.
Thanks a lot, sir. Thank you for your time. We always, when we connect with you, we learn a lot, and it's always amazing to see you keep on creating content which help the dentists grow overall. Thanks a lot, sir.
Thank you so much. It was my pleasure to be here. And I always believe, like, honestly speaking, when I started practicing dentistry 22 years ago, there was hardly any competition. And there was no need of practice management, marketing. In fact, the online world didn't even exist at that time. Okay. So, and when we really had to, work really hard in order to reach where we have reached. So because there were no facilities at that time, there was no mentor to teach all this in India at that time. So the best thing is now everything is on your fingertip. Your phones have become smart. Your wristwatch TV has become smart. It's time for you to become smart. Okay? Just grab this opportunity and keep growing. And I'm on a mission to help 1 lakh dentists in this world to build their millionaire dental. You can be one of them. Join my community, and I'm all yours. Always there for you. Thank you.
Thanks a lot, sir. Thank you.
Thank you.